Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
You're turning into your 40s and you have realized that you have started getting knee pain, and especially when you get up after prolonged sitting or early in the morning, when you try to get up from your bed, you find that initial few steps are really painful. So please do not ignore it. This is a sign of osteoarthritis. Osteoarthritis is a condition, it's an aging condition, a wear and tear condition where the cartilage between the two bones of the knee joint starts to degenerate. Now, because knee joint is our weight bearing joint, most of our weight for so many years will always fall on your knee joint, and the cartilage which is present inside the joint will start tearing up and degenerate, and then you start getting knee pain. So initially, what are the symptoms? So first thing is, like I said, you will have pain and stiffness in the knee joint after a prolonged sitting. So suppose you're watching TV for half an hour and you try to get up, you feel that the knee is not helping you out in taking the steps, and initially 3-4 steps are very painful. Slowly you feel relaxed. So pain and stiffness, early morning pain and stiffness. Sometimes you feel that the knee joint has swollen up, and sometimes when you walk for like half an hour and more, you feel that now you cannot walk and stand. So prolonged pain after walking, and climbing stairs up and down becomes painful. So these are the symptoms of initial stages of osteoarthritis. Now, if you start taking care of your knee joint at this point of time, definitely this osteoarthritis is not going to trouble you in later stages. So what are the precautions? First thing is, go see a pain physician so that they can do a dynamic ultrasound scan. Now in dynamic ultrasound scan, what do we find? We see that if there is any fluid that is accumulated, or we see that how are your ligaments, the AC ligament, the meniscus, the collateral ligaments, the soft tissues, and then we measure the cartilage. So the cartilage can be measured over multiple areas, and mostly on the inner side of your knee joint is more prone for cartilage loss, so we need to measure the height there. Usually at the age of 40 to 50, the cartilage thickness should be around 2.5, but if it has come down less than 1.5, you need to take precautions, and also you need to opt for certain treatment. So once you have been examined by your doctor, make sure to follow the instructions. Now few instructions like doing a quadriceps exercises and spine exercises, reduction in weight if your weight is more, taking some collagen supplements or glucosamine supplements, keeping your calcium and vitamin D levels at check, doing proper exercises, doing a short 10 to 15 minutes of walking using proper shoes, and taking care of your knee joint by not straining, and avoid using Indian toilets, and stop sitting on the floor. So if you start taking all these precautions, the osteoarthritis will not prolong and proceed to further stages, and the duration of progress will decrease. So if you are in initial stages of your osteoarthritis, do not miss to visit your pain physician to get yourself checked.